prostate cancer is the #1 non-skin cancer among men in the United States. And prior to the late 1980s, men were coming in with metastatic prostate cancer and dying of the disease. With the introduction of PSA screening, which is a prostate cancer screening test, we saw a decrease in metastatic prostate cancer because we were catching it early and we were curing a very curable disease. Unfortunately, in 2012, the U.S. Preventative Services Task Force recommended against PSA-based prostate cancer screening. This was very disappointing to most physicians who treat prostate cancer, including oncologists, radiation oncologists, and urologists, because their opinions were not solicited by the U.S. Preventative Task Force when making this recommendation. Since 2012, primary care physicians have been screening patients less, and we've actually seen an increase in metastatic prostate cancer cases since those recommendations came out. The American Urological Association, as well as other organizations throughout the world, came up with their own set of guidelines for PSA-based prostate screening in response to the U.S. Preventative Services Task Force recommendations. For an average risk patient, the American Urological Association recommends screening starting with the age of 55 to 69. Patients who have a life expectancy of less than 10 years or over 70 should not be screened. And the reason for that is because prostate cancer is usually a very slow-growing cancer and usually does not cause metastasis or cause mortality within 10 years. For patients who are under 55 and have a higher risk of prostate cancer, such as African American patients or patients with a family history of prostate cancer, they should have a discussion with their physician, and this should be a shared decision-making on an individual basis, and they may want to be screened earlier. The American Urological Association also doesn't recommend that patients get screened every year, but rather get screened every 2 to 3 years. But again, that is something that should be discussed between the physician and the patient, depending on what the PSA levels were like the previous years and what their trend was. The good thing is that prostate cancer, for the most part, is a very curable disease, as long as patients are aware that they have it. There are many options for managing prostate cancer, but I think it's important to be able to manage it, to have the option of managing it, as opposed to not knowing about it. And patients can have a very long life expectancy with prostate cancer, as long as it is caught early. We encourage patients to speak to their primary care physicians about PSA screening, especially in patients that are at a higher risk for disease.